All right. Hello, everyone, and thank you for tuning in to the HPHR Journal Insights podcast. HPHR Journal is an independent academic referred journal that seeks to improve health equity and social justice through the publication of content grounded in thoughtful evaluation of evidence. It is published by the Boston Congress of Public Health, a nonprofit organization that addresses social change at the nexus of public health, health equity, and social justice. This podcast delves into articles published in HPHR Journal that address complex public health issues in an effort to affect social change. My name is Riva Bajuri, and I will be your host today. I'm joined by Dr. Sandra Matar, co-author of The Traumatic Impact of U.S. Immigration Policies, A Call to Action for Mental Health Care Providers. Her article can be found in HPHR Journal Edition 37 on immigration, available on hphr.org. Please introduce yourself, your professional background, and the content of your research.
Sure. Thank you for having me, Riva, having me here. My name is Dr. Sandra Matar. I'm a clinical psychologist. My pronouns are she, her, hers. And I am a director of training of the Immigrant and Refugee Health Center at Boston Medical Center. I'm also associate professor, assistant professor, sorry, in the Boston University School of Medicine. And I am a supervisor and faculty at the Center for Multicultural Training in Psychology at Boston Medical Center. My research focuses on trauma psychology and multicultural psychology. I train medical residents, I train psychology interns on how to be culturally responsive in working with the patient population at Boston Medical Center. And I also, again, very interested in trauma. And I was one of the founders of the Division of Trauma Psychology of the American Psychological Association.
Great, thank you so much. And kind of building off of that, why did you choose your chosen research topic?
Sure. Well, immigration has been, there's both immigration, culture, and trauma. Those three topics are my passion. Why did I choose them? Well, obviously, my life has to do with that, as being the daughter of Lebanese immigrants in Venezuela, and then being an immigrant myself here and a mother of first-generation children in the U.S. But also trauma. I was impacted by the civil war in Lebanon, and I was very interested in the effects that war had on people. And for my master's thesis, I went to Lebanon and did some field research there to study the impact of war on people at a time where I did not even know about the term post-traumatic stress disorder. And then culture, obviously, because of being the daughter of immigrants, of growing up speaking several languages, the topic of culture has always been of an interest to mine. And I wrote my doctoral dissertation on that topic. It was the title was "The Self-Revisited and Multicultural Perspective," and it was a critique of the individualistic approaches in Western psychology and Western psychiatry on their approach to the self. And it was more of an argument in favor of a more communalistic understanding of self, because that respects culture.
Wow, thank you so much. That's definitely a very profound approach to that. Kind of building off of your research, can you discuss some of the literature that inspired your research and what were some surprising results of your research through your literature review?
Well, it's more the article I wrote for this journal is more of a commentary, but certainly the research in multicultural psychology, research in how racism, for example, and discrimination impacts people's lives, especially when they have trauma histories, and how traumatic can racism and discrimination be. That all that research has been very important in my work, and it has inspired me. I was also one of the writers of the Race and Ethnicity Guidelines in Psychology for the American Psychological Association, and certainly we spend a lot of time writing those guidelines, and it helped me reflect on the role that race and ethnicity has that have in or has in in every aspect of people's lives, and how it impacts communities of color, and how it impacts I guess for those guidelines, we mainly focus on communities of color, but obviously it impacts discrimination impacts a lot of people. Um, so yeah, so basically my research is an intersection of trauma, culture, and now refugee work. I work with victims of torture, and these are people that are seeking asylum in the U.S. And so I do clinical work with them, and I supervise several students, postdoc students, and psychology interns. I supervise them on their work with this population. So it really brings together all of my interests, the work that I do at the refugee clinic. It's called the Boston Center for Refugee Health and Human Rights at Boston Medical Center.
Wow, thank you so much. Kind of building off of that question, how have historically racist policies shaped access to mental health care within the immigrant community?
Well, racism is deeply embedded in the immigration system, unfortunately, and there is a long history in the article we review. For example, the Chinese Exclusion Act, and then more recently the Title 42 policy. That was thankfully a judge recently struck down that policy, but those are meant to exclude people that are, especially from countries that are brown countries or black countries. And if we follow the patterns of immigration and these policies um, for years, we can understand that sometimes it feels as if deliberately they're trying to keep people from entering the U.S. People that are brown or people that are black. So I thought in writing that article, it was important to examine these policies because they impact whether or not this population will seek mental health. There's a lot of mistrust, and if there is mistrust, they will not seek help, and that can have a tremendous negative impact in their quality of life, in their mental health. It's all related. The way also we take care of patients, the way we deliver care at hospitals, is also follows sort of a very uh, colonized sort of systemic approach to care, and sometimes we don't even question it. We take things for granted, or it's not convenient to question it. And so my goal behind writing this article was to raise awareness of how we do things here in the United States. Mainly, I was that was my goal, and but also in the Western world, how do we approach um, healthcare, and how much do we consider the needs of this population? The population of asylum seekers and refugees have very specific needs, and they are not just the regular population that we see at the hospital. So the U.S. immigration policies have tremendous impact on their lives. They, for example, every day, many of my patients are afraid of being deported. That is a content of the dreams that they have, of the nightmares that they have. Many of them have been detained in ICE cages, I would call them. Many of them, the separation of parents and kids, and at the border, all of that it has severe um, sort of traumatic impact on the lives of these families and these children, and we don't truly examine these and discuss this as much as we should. um, and so it's important to raise awareness around what are these policies doing. I had a chance to go to Congress and to lobby and raise awareness on some of the issues that impact Latino mental health. And it's amazing how many of the people there were not aware, really. I mean, you have to educate, you have to raise awareness of what are people facing on a day-to-day basis, and in order to help increase their quality of life. So that's what I do. I train medical residents too at the hospital, and what I do is to help them think about culture, help them think about how the system is rigged against the populations that we see, and how can they become advocates to create more health equity and to increase the quality of life of this population.
Certainly, and that's incredibly admirable and definitely a field that is so important in reshaping how we think about mental health care, immigrant health care in general. And on that note, what would you say the importance of politically informed mental health care for the immigrant community is, and how might this sort of approach be beneficial to other communities as well?
Sure. Well, the way I like to teach and train and supervise is to teach a contextual approach. What is that? Basically, I cannot just apply some manualized evidence-based practices on trauma treatment and apply them with my patients without truly understanding what is the context of the patient's lives. What are they living on a day-to-day basis? Are they being discriminated against? How is that impacting the level of stress in their lives? So sometimes we approach trauma care in very isolated ways. It's like as if individuals lived in a vacuum, and so. It is important to raise awareness around what are these people experiencing on a day-to-day basis. What policies are encouraging and sort of improving their lives, and what policies are become a traumatic barrier for them, because we can not only think that they bring trauma from their countries and then when they come here they are safe. I think one of the main points of that article was also to talk and to raise awareness on how traumatic these immigration policies can be to them in their lives in the US, and sometimes those policies can take over their lives, and that's what you have to talk about in treatment with them. It's not so much whether or not they experienced trauma before, because right here right now they are experiencing the negative impact of those policies, and so how can you do trauma treatment if they feel so unsafe? I think a big part of trauma treatment is to make them feel grounded, feel safe, feel that they can trust. And if they feel that they cannot trust anyone here in the system and they feel afraid, how can you do any kind of trauma work if they are, if they're experiencing fear and lack of trust of their providers, lack of trust of the system? There's no way. I mean, if you think about Dr. Judy Herman's model of approach to trauma care, and Dr. Judy Herman is a very well-known trauma psychiatrist. She wrote the book Trauma and Recovery. The first stage into any trauma treatment is to create safety. In order to create safety, you have to, as a therapist, you have to be aware of what is it in the patient's current life, what is it that's creating an unsafe life, and how come they cannot trust. You can't do any kind of trauma work if you don't address safety. And so the context of the patient's lives is important to address before you do anything else.
Of course, definitely. And this is kind of more of an all-encompassing question of your research, but how would you say your research contributes to health equity and social justice as a whole?
Well, I see my clinical work and my training work at the hospital, and also in my writing. How does it address health equity? I think that I'm training medical residents, and I'm training medical students and future psychologists to become aware of what are some of the barriers that come in between patients and health providers. We talk about culture and how to be culturally responsive. If you learn how to be culturally responsive, you're going to be able to bridge that gap with the patient. They will come back repeatedly to see you, and that creates and they will feel taken care of. They will feel trust, and so um, I guess by training all these wonderful trainees, by training them around culture, how to be culturally responsive, I'm teaching them how to connect and how to create trust. That is certainly a way to create health equity. Also, another way to create health equity is to challenge some of the practices we have at the hospital, and trying to see the way we do things in a different way, so that we can decolonize these practices and be more attuned to the actual needs of the patient. So all of that impacts health equity.
Of course. And you mentioned decolonizing the healthcare practices, and that kind of brings me to my next question of how do we adequately implement these culturally responsive healthcare um, remedies from more of an institutional perspective?
Yes, there are three branches here. You have the who is leading the healthcare hospital, who's leading the hospitals, who are at the top, and how diverse, how much does that those leaders, how much do they reflect the population that they serve? That's an important question. How much do doctors and healthcare providers reflect the population that they serve? That's a very important question. Another one is training. Training is very important. Training doctors, healthcare providers to be culturally responsive is absolutely essential. And thirdly is the how much do we consider the opinion, or how much do we take into account the opinion of patients? We have last year we put together a patient advisory council, and in order to try to understand the perspective of patients. I think that it's not only important to have having created that patient advisory council, but also how do we incorporate the feedback that they give us at the refugee clinic? How do we incorporate that? That, I think, that part is extremely important. So is to hear the voice of the patient, to train clinicians, and to have a diversity of people at the hospital that reflect the community. All those things are extremely helpful in creating more health equity. Yeah.
Of course. And so, what is your call to action for the audience? And the term audience, if you don't mind specifically who you would like to refer to in terms of the audience, like break up the audience into different people that you want to reach during answering this question.
So, well, I would like to address my audience to be the all health providers, but I'm not sure. I'm not sure I understand the question. So I'm thinking of health providers mainly. What is your question?
Yeah. So, what is your call to action for the health providers and also for the individuals that might have just read your article who aren't necessarily health providers?
Well, it is important that we become engage in self-awareness, self-reflection, to have some cultural humility, and to be able to say, I think to go beyond, oh, I have good intentions, I want to help these people, to go beyond that and say, are you able to understand how do these people look at you? Are you able to self-examine and understand what are some of your biases and prejudices? Do you have the guts to examine what you do, and to get feedback from people, and understand that you might have amazing intentions, but the impact of your actions can be very problematic? So that's what I encourage health providers to do. We tend to focus our attention, when there's a problem, we focus our attention on the other meaning being the patients or the system, but we rarely take a look at what is it that we are doing. And that can be problematic. Are we willing to examine our own biases? We have biases with patients. There are that create a lot of therapeutic impasses, a lot of clinical problems. Are we willing to examine those? And it takes a lot of cultural humility to do that, and not everybody is willing to do it.
Definitely. That was actually my last question for you, but do you have any last comments regarding your research which you would like to share?
No, I just want to say that my intention is to raise awareness on how to be more culturally responsive, because we are very lucky to be in the U.S. We're very lucky to be able to receive all the population of immigrants and refugees, and um, it's a privilege, but it's also a responsibility. And yeah, to think about that, and that we are responsible to be more responsive when we are delivering healthcare. It is, and we need to constantly examine what is it that we're doing, and how are we doing things. We need to be committed to examine those things, so that we can improve the way we deliver healthcare.
Great. Well, on that note, I would just like to thank you for joining me here on the HPHR Journal Insights podcast, and also for your ongoing commitment to health equity. It's certainly very admirable and important.
Thank you so much for having me, Riva.